Welcome to our poster presentation on motor skill performance of young adults with autism spectrum disorder. This data is part of a larger study in which performance of motor skills by college students with and without ASD were analyzed and compared using a kinematic approach. And this poster shows the standing long jump. Fundamental motor skills lay the groundwork for participation in recreational sport activities through life. We know that children with ASD exhibit poor motor skills, which may be a barrier to participation in recreational activities. But it's not well understood if and how motor skill performance changes through adolescence and into adulthood. Therefore, it's important to carefully analyze the movement patterns to understand any differences so we can inform instructional practices.
For this study, 20 college students, 10 with ASD, between the ages of 18 and 29 participated in this study. Each participant was fitted with the reflective markers and performed 5 trials of the standing long jump. Trajectories of reflective markers were recorded at 250 Hz using a 12-camera 3D motion capture system. Dependent variables included bilateral differences in peak, hip, knee, and ankle joint angles during the counter movement, takeoff, and landing phase of the standing long jump. Independent t-tests were used to compare differences between groups.
When it came to the results, we found significant differences in time difference between the initiation of knee extension and initiation of ankle plantar flexion of the non-dominant leg. Takeoff angles were also significantly smaller in the group with ASD, but similar takeoff velocity was displayed in both groups. The group without ASD jumped 21.7 centimeters further than participants with ASD.
When performing the standing long jump, the ASD group's movement pattern was less efficient, but not underdeveloped. Hence, it is important to explore the subtle differences in the movement mechanics in the ASD population in order to provide better instruction and motor interventions.